There are lots of news headlines about this new mysterious virus in China, but it sounds like they're having an outbreak of lots of different respiratory viruses, including RSV and flu, and something called human metapneumovirus, which is not new or mysterious. I, in fact, had my own run-in with it about 2 years ago. This is a well-known virus that causes typical upper respiratory symptoms: cough, fever, runny or stuffy nose, sore throat, sneezing. You can have shortness of breath or wheezing or both, and a rash. For most people, it's a mild to moderate upper respiratory infection, and they're going to get better on their own without any significant interventions. But in the hospital, we do see kids that are having more difficulty breathing, or people that have asthma that are triggered by this virus, and sometimes they do need some respiratory support and admitted to the hospital. Because it is a virus, antibiotics do not work to make you better unless you develop a secondary infection, something like an ear infection or pneumonia. Some of the Chinese health authorities are saying most of the infections that are happening are actually influenza, and 30% of the tests for flu are positive for flu. And we know flu can be quite dangerous, especially for young people, old people, and people that are immunocompromised. Admittedly, China was not super forthcoming with information about the COVID-19 pandemic, but at this time, the things that they're seeing over there are very similar to the things that we're seeing in our emergency departments over here as well. And while we're not overwhelmingly surging, we are seeing lots of patients. The United States and China obviously dealt with the pandemic in different ways with regards to lockdowns and such. And the things that China is dealing with right now feel very similar to what we dealt with back in the fall of 22 with the pediatric tripledemic, where pediatric hospitals were overwhelmed and in crisis mode with the number of respiratory issues, flu, RSV, and COVID that kids were dealing with. We didn't have emergency beds, we didn't have ICU beds, we didn't have floor beds, we didn't have vents. We were just trying to manage with what we have, and we were all definitely in crisis mode. This year in the United States, this respiratory season feels busy, but pretty typical of what we would expect for a normal respiratory season. And currently, we are not being overwhelmed by any mysterious respiratory illness. With regards to what's happening in China, it is not time to panic. We're still in an info gathering phase. From what it sounds like, they are dealing with typical respiratory illnesses, and there is no new mysterious virus. Focus on the things that you can do to keep yourself healthy. Make sure that you're getting enough sleep, eating a well-balanced diet with lots of fiber and fruits and vegetables. Make sure that you are moving your body every day. Make sure that you are washing your hands. And if you're going into a crowded place or a doctor's office or hospital, consider putting a mask on because it's nasty out there. It's not a time to panic. Just do your best to stay safe.